exceedingly foolish or gullible to believe the messages you're hearing from some people that tell you that these things don't matter. Well, maybe they don't matter if you're going to be dead at a younger age, but if you're going to live a long time, they do matter. And it's my mission to make sure that people don't make these mistakes that I've seen so many people make and result in tragic consequences. So we're talking about a nutritarian diet. Is a diet that's scientifically designed to be maximally lifespan promoting. And it beats the blue zones out of the water, because blue zones, are eating better than the average American, but you don't buy a car by comparing it to a junkyard wreck. The American diet is to be better than an American diet is not saying too much. That's the diet designed by Al-Qaeda. The point I'm making here is that we're taking we know why the blue zones diets are better than American diets, right? But we're taking that data and putting it together with all the research and science that shows the protective, anti-cancer, and lifespan promoting effects of scallions and cruciferous green vegetables and mushrooms and beans and pomegranates and berries. So here's what I want you to do. I want you to eat some raw onions scallions every day, to eat cruciferous greens every day, mushrooms every day, cooked beans every day, berries, pomegranate, or cherries, some of these high anthocyanin food-containing foods every day, some flax or chia seeds every day, maybe at least a teaspoon of each every day. Just a little bit goes a long way. And at least 1.5 ounces of nuts and seeds a day, which is a lot compared to what most people eat. And you know what? Out of that 1.5 ounces of nuts and seeds a day, which is about 1/2 ounce of each meal, which is what we feed people here at my retreat in San Diego. People come here, they're 30 pounds overweight, they're 50 pounds overweight, they're 100 pounds overweight, they're 150 pounds overweight. They're here to get rid of their food addictions, to learn how to do this, to be able to develop the tools and the mental attitude to do it at home, whatever they're doing in here. We're feeding them about 1/2 ounce of nuts with each meal. That's a whole tablespoon of seeds on their morning cereal, on their morning grain. They're eating a salad dressing with nuts and seeds in their lunch, about 1/2, and they're still losing weight. Maybe an averaging 20 pounds the first month in males and 15 pounds the first month in females. And maybe 10 pounds the first, maybe 15 pounds the second month in males and 10 pounds weight loss the second month in females. We're seeing dramatic amount of weight loss using nuts and seeds moderately. Adds to the results. It doesn't take away from them. So take charge of your health destiny. And let's talk about supplementation for a second, because I just want to make it clear that certain supplemental ingredients contained in many conventional multivitamins shorten lifespan. And I'm claiming that there's evidence that's overwhelming that taking folic acid, vitamin A, beta-carotene, vitamin E, and copper, and even iron if you don't need it, has the potential to shorten lifespan. So that means taking nutritional yeast that's fortified, that has folic acid added, could increase risk of breast and prostate cancer. That means drinking soy milk that's fortified with vitamin A, with acetate and palmitate, and drinking plant-based milks that are fortified with vitamin A could shorten lifespan. So we don't want to use fortified foods. We don't want to use foods fortified with folic acid and B vitamins, because B vitamins include folic acid usually. And we don't want to take things with vitamin A added to them, or beta-carotene. However, there are certain nutrients that are more readily absorbed from animal products and are not as optimally assimilated on a plant-based diet. And you should know what those are. Besides, we talked about DHA and EPA, which is one. There are 5 others. And the 5 others are B12. Vitamin D really doesn't count because that's the sunshine vitamin. That's a hormone in the body. So you don't have to eat vitamin D. You take it as a supplement. You can get enough sun, but then you're risking more wrinkle development and skin damage. But still, most people have some combination. It's more conservative to do some combination of not burning ourselves in the sun, a little bit of sun exposure with some vitamin D exposure to make sure our level is in the normal range, like 30 to 50. I'm not a person who's recommending people take excessive amounts and pushing their level like some people are, taking 5,000 or 10,000 a day, trying to pick your levels too much, because I want to make it clear here that too little of certain nutrients can be bad, and too much is also bad. The homeodynamic relationship is that both too much and too little cause problems. You want to be in that mid-range, so we don't want to look for a supplement that has excessive amounts of anything. You shouldn't be taking excessive amounts of vitamin D, thinking more is better, driving your level to 60, 70, or 80 in the bloodstream. So zinc, iodine, of course, which is the RDI for iodine, is 150 micrograms a day, which is a small amount. And we're not using salt or iodinated salt, so we have that in supplemental form. or you could get it from kelp, a little bit of kelp. And zinc in small amounts, because even though the zinc present in plant foods, it's not as absorbed readily compared to animal products, because the phytic acid binds zinc absorption, limits the absorption of zinc from plants. And as we age, zinc absorption goes down, and zinc supplementation has been linked to a lower risk of immune protection from pneumonia, infection, and cancer in later life. So zinc supplementation makes sense on a plant-based diet. And vitamin K2, lots of great evidence vitamin K2 is beneficial. Our body makes some vitamin K2 from the changing of K1 in plants to the bacteria in the gut performing in K2. We don't have enough data on that to know if we make ideal amounts. And K2 supplementation has so much positive results to show that strengthening of the bones and preventing calcifications of joints of the heart. In other words, it prevents calcium from going to places it should not be deposited in, maintaining more strength in the bones. So there's an overwhelming amount of evidence. And even so, we can't use any blanket recommendations. I've heard people, people say, oh, supplements are bad. Get your nutrients from food. And that's true to a degree, because obviously we should get most of our nutrients from food. But just because I could show you studies showing supplements are bad and nutrients from food are better, doesn't mean we don't benefit from certain supplements that are relatively low in the diet, because there's not 25 different vitamin zinc fragments in food. Whereas there are 100 different carotenoids, and when you take just the beta carotene from a supplement, you're not getting the whole what food contains. So there's no blanket statements here. We got to look at the evidence, right? We can't come up with these, quips, statements, and send people just believe what you're saying because you're respected or something. Because there's too much bad information given out of these podiums. We got to look at the data so people can make sense of it and make sure that there's overwhelming amount of evidence supporting the recommendations. So here's the conclusion, that if you're on an SAD diet, you're not going to have a good quality of life, and you're going to have your quality of life deteriorate before you die. So you're not just dying prematurely, because people say to me, oh, I just want to eat what I want to eat and live life and enjoy my life more. But you're not going to enjoy your life more. The last 10 or 20 years of your life become a living hell with all kinds of medical conditions. And then on a Nutritarian diet, you're not just living longer, you're living with using these guidelines, with your full mental and physical capacities in your later life. So you can really enjoy your healthy lifespan and play span. That's what I'm looking for. I'm working less and living life more, enjoying my life more while I'm still in good health. And that's why that is so valuable, to love the food you eat, improve your taste muscle, learn the healthy recipes, but learn the guidelines of healthy eating without going too extreme into these fad type of plant-based diets where you're trying to restrict food to certain things too much or move something in the wrong direction. All right, most of this lecture has come from my book, Eat for Life, and I'm mentioning that because it enables people to look at 2,000 scientific references, realizing the advice they're getting is well supported. And of course, you can go to drfuhrman.com, where I have events and motivation, and you can ask me questions there. Or you could watch my masterclass there with 20 lectures. In other words, how about products and services, drfuhrman.com, to make your life, your education, and your life easier. And of course, if I have this beautiful retreat in San Diego for people who really need to be somewhere to get this and really need to get away, I love doing this because I love impacting people, getting to know them, and changing their life forever. All righty, I am done with this presentation, and I will allow you guys to be able to ask me questions.